When does a simple infection stop being simple? We often hear about urinary tract infections, or UTIs, and think of them as a common, easily treated annoyance. A quick trip to the doctor, a round of antibiotics, and you're back to normal. But what happens when it doesn't stop there? What if that simple infection quietly travels upward, threatening one of your body's most vital organs? This is the story of how a common problem can escalate into a serious health crisis, and the red flags everyone needs to know. Most UTIs start in the lower urinary tract, specifically the bladder. This is called cystitis. You feel that classic burning sensation when you pee. You're running to the bathroom constantly, but not much comes out, and maybe your lower belly feels tender. It's uncomfortable, for sure. The culprit is usually bacteria that have found their way into the urinary system. In a healthy person, with prompt treatment, the infection is cleared up, and that's the end of it. But sometimes, the story doesn't end there. The bacteria aren't fully eliminated, or there's an underlying issue that makes it harder for your body to fight back. This is where things can get complicated. Imagine the bacteria as tiny climbers. Instead of being flushed out, they start to ascend the ureters, the tubes connecting your bladder to your kidneys. Once they reach the kidneys, the infection is no longer just a simple UTI. It has now become a kidney infection, a condition doctors call pyelonephritis. This is a much more serious situation. Your kidneys are powerful filters, working around the clock to clean your blood. When they get infected, their ability to do this crucial job is compromised. This isn't just about discomfort anymore. It's about a direct threat to a major organ. So who is at higher risk for this dangerous journey? Think of someone like an elderly man with an enlarged prostate. The prostate can block the normal flow of urine, creating a stagnant pool in the bladder where bacteria can thrive and eventually travel upwards. Or consider a pregnant woman. The hormonal changes and the pressure from the growing baby on her bladder can make it harder to empty it completely, giving bacteria a chance to multiply and ascend. People with diabetes are also more vulnerable, as high blood sugar can weaken the immune system and even damage nerves that control the bladder. Even something as simple as a kidney stone can create a blockage, setting the stage for a severe infection. These aren't just medical conditions. They are real-life scenarios that turn a common UTI into a complicated one. The real danger lies in ignoring the warning signs that the infection has moved beyond the bladder. The symptoms of a kidney infection are distinct and more severe. You might suddenly develop a high fever and feel chills, as if you have the flu. A persistent, deep ache in your lower back, side, or even your groin is a classic sign. This isn't the same as typical back pain. It's a specific, localized discomfort. You might also feel nauseous and even vomit. And of course, the original UTI symptoms, the painful, frequent urination, are usually still there, sometimes with cloudy or foul-smelling urine. Here's the part people dangerously underestimate. They mistake these symptoms for something else. Oh, it's just a bad flu, or I must have pulled a muscle in my back. They might take an over-the-counter pain reliever and try to wait it out. This is a critical mistake. While you're waiting, the infection is raging in your kidneys. This can lead to the formation of abscessized pus inside the kidney tissue, causing permanent damage and scarring. If left untreated, the bacteria can escape from the kidneys into your bloodstream. This triggers a life-threatening condition called sepsis, where your body's overwhelming response to the infection can cause organ failure and even death. Your simple UTI has now become a full-blown medical emergency. Recognizing the shift from a bladder infection to a kidney infection is vital. Don't dismiss back pain, fever, and nausea if you also have urinary symptoms. It's your body screaming that the infection has escalated. Prompt medical attention and the right antibiotics are crucial to stop the infection in its tracks and prevent irreversible kidney damage. A UTI is common, but complication is a risk we can't afford to ignore. Listen to your body, understand the red flags, and never hesitate to seek help when a simple problem starts feeling seriously wrong. Thanks for watching, and remember to take care of yourselves.